Dr. Singer, I was wondering if you could just tell me a little bit about your experience with KCRS and what you're most excited about for this meeting this year.
Sure. Well, KCRS is a fantastic organization. Love being able to collaborate with Brian Lewis and the rest of the team. Always wonderful to be back in Boston, especially when the Red Sox are actually doing well this past stretch.
Yeah.
One of the things I really love about KCRS is being able to meet with our other investigators, think about what clinical trials, what gaps we have in our portfolios, and how we can move towards our goal that we have at Ohio State University Comprehensive Cancer Center, which is to be able to offer a clinical trial for every patient at every stage of disease. Certainly, clinical trials aren't the only option. We pride ourselves on being able to offer standard of care extremely well, but I really think it's important to be able to have investigative options so that we can really make sure we're tailoring the right treatment at the right time for each patient.
And can you speak a little bit to when a patient might think clinical trials are just once they're out of treatment options, and that's not necessarily the case?
No, that's a really great point. Clinical trials are certainly not sort of the last stop on the train. I like to think about clinical trials whenever we have a new diagnosis, whenever we have a change. So if there's a sign of progression, to reevaluate and say, hey, we have a need for a change in treatment. Let's think about what trial options might be right for you at this time. We also have clinical trials going on in terms of prevention. There are trials in terms of adjuvant therapy, so again, trying to reduce that risk of having kidney cancer come back. So I think you're exactly right. Trials are something we should be thinking about throughout a patient's kidney cancer journey and not just at one time point.
And if you could just also just a little bit elaborate on the fact that these clinical trials, not only could it be the best treatment option for a patient at a certain time, but the data that it provides for patients down the road and how it can just benefit the greater kidney cancer community.
Sure. In my career, I've really seen the treatment options for kidney cancer change dramatically. So I'm of the cohort where I remember sunitinib and sorafenib being approved for kidney cancer, our first targeted therapies. We've now sort of gone through the targeted therapy era. We're now into the immuno-oncology era, and each one of those breakthroughs was really made possible because of patients and their family members and caregivers embracing the idea of clinical trials for us to generate new knowledge carefully, safely, and in a well-researched, scientifically supported way so we can really move the field forward. The only way we get to move forward is through our clinical trials.